It's a phenomenon witnessed around the world.
From every walk of life.
As a life is nearing the end.
Breathing will change, heart rate will change.
They feel a little unsettled.
Often staring at the corner of the room.
The soul or the spirit or the life force is trying to get going.
But they're not going alone.
Every religious tradition, every wisdom tradition talks about these beings that come to get us when it's time to die.
Unexplained manifestations called end-of-life visions or visioning that are only visible to the patient, usually.
The patient was visioning over at that side of the room, and this little 2-year-old boy said, "Who's that sitting over there?"
At Hospice of the Western Reserve, they say entering a patient's room is sacred space.
I've had a number of patients who will all of a sudden open their eyes like they're startled, get a big smile on their face, take one last breath, and they're gone.
Although they provide unconditional support regardless of a person's beliefs, they've also witnessed countless cases that defy logic.
She goes, "Oh, when did you get here?" And I said, "I'm Dave from Hospice of the Western Reserve. I've been here for a while." And she looked at me and she said, "Not you, George." And I turned around and looked, and there was nobody behind me.
George was the patient's long-deceased husband.
She just kept looking past me and saying, "Oh, you look so good." And then I found out that she did pass away the next day.
They say a parent or spouse is most common. For a man named Ron, his beloved wife, Becky.
He actually pulled himself over the side rail and reached out and made like a hugging motion and then laid back down, and within minutes he died. He had been waiting for her to come get him.
For another man, it was the family pet.
He said, "I can see, and it's beautiful here. It's beautiful." He goes, "There's animals." And then he stopped and he looked at his son and he says, "Your dog is here." Yeah. And so of course now we're all crying, you know, and then it was like probably an hour and a half later that he died.
Some scientists and skeptics say the visioning's nothing more than hallucinations brought on by drugs or disease, or possibly the brain's coping mechanism dealing with death. But Dr. Kevin Dieter says not every patient visions, and those who do are entirely lucid.
Folks that are dying still can have hallucinations, but they are qualitatively and quantitatively different.
And if you try to get their attention and you call them out of that, there's like a transition back to this world, and they don't like it.
Because most visioning involves people already deceased, even if the patient doesn't know it.
About 2 weeks prior, her son had passed away, and they decided because of her condition they weren't going to bother telling her.
Margaret was bedridden for weeks, then suddenly got all dressed up.
Her sister, Dorothy, walked in. She said, "Margaret," she said, "you look beautiful. What's going on?" She said, "Charles came to see me, and he said he's coming back to take me with him." And she didn't know that. He had passed away 2 weeks before, and the very next day she passed away as well.
And afterward.
A lot of times I notice a difference in the feeling from right before they pass away to after they pass away.
For some reason, a cardinal showing up seems to be fairly common. We don't know why they do that, but they do that a lot.
Are you having any pain at all right now?
Comforting loved ones and hospice staff members, sharing their stories to help comfort you.
It's just like one of those things that you want to say, wow.
It just gives you such great hope, and you wonder who's coming for you, you know?
In Cleveland, Suzanne Stratford, Fox 8 News.